A morning in the hospital. Sunlight strikes the room. A bright picture of a lady lying on the bed. The doctor walks in to check her health. Putting the stethoscope on her chest and checking on the little one lying on the bed. The doctor does her rounds, checking up the other patients in the hospital. Before coming into physical contact with each patient, it is very important for the medical officer to wash the hands clean. A medical officer must take all precautions before touching the patients, as their life depends on the caretakers. Hospitals have to be shrines of cleanliness. But with the past cases of high morbidity and mortality rates, the status of these hospitals and the faith of the people was severely compromised. With contaminated water sources, bad sanitation, and a lack of hand-washing facilities being the crux of the problem. The lack of these services failed to provide first-class and safe services, such as child delivery and ability to prevent and control infections, resulting in the increasing rates of neonatal and maternal mortality. According to the reports, in India, out of the total neonatal deaths happening nationally, 40% of newborn and around 46% of the maternal deaths occur on the day of birth itself. At any given time, over 1.4 million people worldwide suffer from infectious complications acquired in hospitals. There are various programs led by the Ministry of Health and Family Welfare to improve quality of the care. This includes Kayakalp, National Quality Assurance Standard, National Accreditation Board for Hospital and Healthcare Facilities, and National Accreditation Board for Laboratories. The medical officer should ensure the following steps to obtain the NQAS certificate. The medical officer must take these steps in order to obtain the NABH accreditation. From improvement in the healthcare facilities to quality services and clean drinking stations. The safety of the lives increase with a remarkable decrease in mortality rates. This increases responsibility on the capable shoulders of the medical officers. The medical officers have to assign formal written responsibility to a fixed person for regular supervision and monitoring. There are supervised visits of the premises daily by the institute head and visiting officers, and also include wash-related officials in the visit. The government of Gujarat has initiated Swachhata audits on the 6th of every month and inspects the facility. The survey form, comprising 25 questions, is designed for the same. It is also monitored at the state level. To strengthen supervising and monitoring, a separate website has also been designed by Quality Improvement Cell. The site will serve to converge between various district and state officials for the grievance redressal. Under the Swachh Swasth Sarvatra initiative, selected health facilities in open defecation-free blocks will be eligible to receive 10 lakh rupees for the improvement of the healthcare facilities. The medical officer should also provide and organize a periodic training about the importance of wash and biomedical waste management to the staff of the center, including housekeeping and cleaning staff, ward boys and others. The medical officer should implement and ensure the cleanliness before and after all deliveries, keeping in mind the 6 important cleans: clean hands, clean perineum, clean delivery surface, clean cord cutting, clean cord tying, clean cord care. Post the delivery, it's the medical officer's responsibility to ensure the safe and clean conditions of the maternal and neonatal ward. The medical officer should also guide the staff on the importance of hand washing before and after touching patients, in order to ensure a safe and clean practice around and across the hospital. To ensure the safe and clean conditions of the hospital with a proper waste disposal system and clean floors with proper mixing of hypochlorite solution with water to create a safe and infection-free environment for the patients. Along with this, there should be safe condition of drinking water and hand washing stations. To acknowledge and reward the remarkable efforts and work of the medical officers, the government awards their contribution through the Kaya Kalp Award scheme, where the top 2 ranked district hospitals receive awards for excellence on the maintenance of optimum cleanliness standards, making the staff work harder towards ensuring a clean environment of the hospital, making the efforts of the medical officer constantly improve, resulting in changing the image of the hospitals back to being the place where a mother's and child's safety is the key to a long and healthy life.